I want to share with you a very interesting, powerful technique to be able to go to sleep within minutes. But first, I want to kind of remove some of the other things that can interfere with this technique. Number one, overtraining. If you're exercising too much, your sympathetic nervous system will go up, and that will keep your adrenaline high, and you will not be able to go to sleep. For some people, the best high-intensity interval training exercise should be done maybe twice a week versus even every other day. That can keep someone up. Also, if your room is a little too hot, that can interfere with your ability to sleep. If you do a lot of carbohydrates, that can deplete B1, which will then keep you up at night. A real simple remedy is just to take some B1 right before you go to sleep. It helps so many people. And you will feel like within minutes like this calmness. Vitamin B1 is essential for the parasympathetic nervous system. And also, it's not just the carbs that can reduce your B1. It could be also stress and too much tea. That caffeine is still in their system. It might seem like a real simple thing, but it seems to work for a lot of people. If your gut microbiome is not right, that will greatly interfere with your ability to sleep. Kefir as a probiotic will greatly help your sleep. Maybe half of a cup. Not to mention giving you some calcium, which also can actually help you go to sleep as well. If you are insulin resistant, you're not going to be able to absorb as much tryptophan from your diet, turns into serotonin, and then into melatonin, the sleep hormone. And that could be another reason why you're not sleeping. Sometimes when people do the ketogenic diet for a long period of time, or even the carnivore for a long period of time, your insulin level will go really low, okay? And you're going to become insulin sensitive, okay? So that means your insulin receptors are going to work really well, but you might be on the low side with insulin. And remember, we need insulin for all sorts of things. We need insulin to help us absorb more amino acids, nutrients. But here's what I noticed. Some people who have done the ketogenic diet for a period of time and then the sleep isn't as great will benefit from adding maybe 1 to 2 cups of berries with their last meal. And that's still going to be under that 50 gram of carb. So that will be enough carbs with the fiber to raise that insulin a little bit to allow more tryptophan to enter the blood-brain barrier and help you sleep a little bit better. You should try it. It might help you. And then you have another factor. If you're deficient in sodium, because maybe you're fasting, you're doing 1 meal a day, and you're not really adding enough sodium or salt to the diet, your sympathetic nervous system will have a tendency to go up. And that can keep you from sleeping. So a little more salt during the day helps you sleep. Now I'm going to show you the technique. And this is legitimate. It's an actual technique that is based on science. What you're going to do is you're going to synchronize your heart to your lungs. Basically, we're going to breathe in a certain way to create this optimized synchronization between your heartbeat, your blood pressure, and the rhythm of your breathing with your lungs. And it's going to help you stimulate something called the parasympathetic, which will induce a wonderful sleep. So here's a secret, and you might want to practice this with a timer first because it's hard to be exact, but this is how you do it. You want to breathe in for 5.5 seconds and breathe out 5.5 seconds. But if you synchronize your breathing in and out at a 5.5 seconds each, that will give you about 5.5 breaths per minute. That creates this synchronization. And you want to breathe through your nose. You want to do it very gradually. And I'm telling you, within minutes, I go right out. And if you haven't seen this video on more data about breathing and getting enough balance between CO2 and oxygen to pull yourself out of a panic attack, you should check this video out right here.